HY review, communication and behavioral science. The final piece, how to talk with patients, handle the hard conversations, and the behavioral and research ethics facts. The exam loves. These are pure points if you know the moves. Read the scenario, pick the best response, commit, and move. What is the most empathetic response? While a physician explains a new cancer diagnosis, the patient's eyes fill with tears and she begins to cry. Read the command, the most empathetic response to a crying patient. Name and acknowledge the emotion. The most empathetic response names and acknowledges the patient's emotion, showing you see her distress and are present with her, saying, "I can see this is really hard for you," validates her feelings and invites her to share more. Empathy means recognizing the emotion, not fixing or deflecting it. The correct answer is C. Saying everything will be fine is false reassurance that dismisses her real distress and may not even be true choice, a wrong. Many people have it worse, minimizes her feelings and can make her feel unheard choice, e wrong. Acknowledging that this is hard for her is the empathetic response. Which is an open-ended question. A physician wants to begin the interview in a way that lets the patient tell their story in their own words. Read the command. Which question is open-ended? It cannot be answered with just yes or no. An open-ended question invites the patient to respond in their own words with a narrative rather than a one-word answer. What brings you in today? Opens the floor and elicits the patient's story and concerns. Open-ended questions are the ideal way to start an interview before narrowing down with focused questions. The correct answer is E. Do you have chest pain? Can be answered with a simple yes or no, making it a closed question that limits the patient's response. Choice A wrong. Have you had this before? Is likewise a closed yes or no question, useful later but not for opening the story. Choice C wrong. What brings you in today is the open-ended question. Which technique is this? A patient is ambivalent about cutting down his drinking and becomes defensive whenever the physician pushes him. Instead of arguing, the physician asks the patient to describe his OWN reasons for wanting to change and reflects them back, gently exploring his ambivalence. Read the command, the technique of drawing out the patient's own reasons to change. That is motivational interviewing. Motivational interviewing is a collaborative, non-confrontational technique that elicits the patient's own motivations for change and rolls with resistance, rather than arguing. By having the patient voice his reasons and reflecting them back, the physician strengthens the patient's intrinsic motivation. Pushing or confronting an ambivalent patient usually increases resistance. The correct answer is B. Confrontation directly challenges the patient and tends to harden resistance in someone who is ambivalent, the opposite of what is happening here. Choice A wrong. Question pressures the patient rather than eliciting his own motivation, which undermines autonomy and rapport. Choice D wrong. Drawing out the patient's own reasons is motivational interviewing. What should the physician do? A patient with low health literacy looks lost and confused as the physician explains the plan using terms like hypertension, myocardial infarction, and titrate. Read the command, how to communicate with low health literacy. Drop the jargon, use plain words. When a patient has low health literacy, the fix is to use plain, everyday language instead of medical jargon, high blood pressure rather than hypertension, heart attack rather than myocardial infarction. Clear, simple wording lets the patient actually understand and participate in their care. The correct answer is D. Repeating the same jargon more loudly does not make unfamiliar terms any more understandable. Choice A wrong. Handing over a medical journal article gives even denser, more technical language to someone already struggling with the words. Choice B, wrong. The physician should use plain, everyday language. What is this technique called? After explaining how to take a complex new medication, the physician asks the patient to repeat the instructions back in his own words to confirm he understood. Read the command. The technique of having the patient repeat instructions back, that is teach back. The TEEH back method has the patient explain the instructions back in their own words so the physician can confirm genuine understanding and correct any gaps. It checks comprehension rather than just asking, "Do you understand?" which patients often answer yes to regardless. It is one of the best tools for safe, effective communication. The correct answer is A. Informed consent is the process of agreeing to a treatment after disclosure, not specifically the technique of checking comprehension by having the patient restate instructions. Choice C, wrong. Motivational interviewing is about eliciting motivation to change behavior, a different goal entirely. Choice B, wrong. Having the patient repeat instructions back is the teach back method. What is the best response to the patient's silence? After being told difficult news, a patient falls completely silent and looks down. The physician feels an urge to fill the quiet. Read the command. How to handle a patient's silence after bad news. Give them room to process. After difficult news, silence is therapeutic. Allowing a respectful pause gives the patient space to absorb the information and gather their thoughts, and it signals that you are present and unhurried. Rushing to fill the quiet serves the physician's discomfort, not the patient's need. The correct answer is C. Filling the silence with reassurance interrupts the patient's processing and often comes across as dismissive of the moment. Choice B, wrong. Quickly changing the subject avoids the patient's emotion and cuts off their chance to respond. Choice A, wrong. The best response is to allow a respectful pause. Which part of Breaking Bad News does this represent? Before disclosing a serious cancer diagnosis, the physician moves the patient to a private, quiet room, sits down at eye level, and begins, "I'm afraid I have some serious news to share with you." Read the command. Which step of Breaking Bad News this is? Private setting plus a lead-in warning. Arranging a private, quiet setting and giving a brief warning shot. A lead-in, like "I'm afraid I have some serious news," are the opening steps of Breaking Bad News. This setup ensures privacy and full attention, and the warning shot prepares the patient emotionally for what is coming, so the disclosure does not land abruptly. The correct answer is E. Informed consent is the separate process of agreeing to a treatment after disclosure of risks and alternatives, not the preparation for delivering bad news. Choice or wrong. Teach back is a comprehension check where the patient restates instructions unrelated to setting up a difficult conversation. Choice B, wrong. This is setting up the encounter and giving a warning shot. These behaviors are examples of what? During a visit, the physician makes eye contact, sits down at the patient's level, nods as the patient speaks, and does not interrupt. Read the command. What these behaviors demonstrate. Eye contact and attentive body language are active listening. Making EYE contact, sitting at the patient's level, nodding, and not interrupting are forms of ACTI listening and positive nonverbal communication. They convey attention, respect, and engagement, building rapport and trust. So much of effective communication is conveyed through body language rather than words. The correct answer is D. Paternalism means overriding the patient's preferences with the physician's own judgment, which has nothing to do with attentive body language, choice, or wrong. A boundary violation is an inappropriate crossing of the professional relationship, the opposite of respectful listening, choice, B, wrong. These behaviors are active listening and positive nonverbal communication. What is the purpose of these questions? Near the start of a visit, the physician asks, "What are you most worried about?" And is there anything else you were hoping we could cover today? Read the command. The purpose of asking about worries and other topics. It surfaces what matters to the patient. Asking what the patient is most worried about and whether there is anything else to cover elicits the patient's concerns and full agenda up front. This prevents the doorknob complaint raised at the very end, ensures the visit addresses what matters to the patient, and centers the encounter on their priorities. The correct answer is B. Assessing decision-making capacity involves testing whether the patient can understand, appreciate, reason, and communicate a choice, not asking about their worries. Choice D, wrong. Screening for depression uses specific mood and anhedonia questions, not an open inquiry into today's concerns. Choice E, wrong. These questions elicit the patient's concerns and agenda. What is the best initial response? A patient who has waited a long time raises his voice and angrily criticizes the physician the moment she enters the room. Read the command, the best first move with an angry patient. Acknowledge the feeling and stay calm. With an angry patient, the first step is to acknowledge the emotion and stay calm and non-defensive. For example, I can see you're frustrated by the long wait, and I'm sorry. Naming and validating the feeling de-escalates the situation and opens the door to addressing the underlying concern. The correct answer is A. Arguing back to defend yourself escalates the confrontation and puts the physician and patient on opposite sides. Choice B, wrong. Telling him to calm down or leave is dismissive and confrontational, likely inflaming the anger further. Choice E, wrong. The best initial response is to acknowledge his frustration and remain calm. What is the best approach? A patient with diabetes repeatedly does not take his prescribed medication. Rather than scolding him, the physician wants to understand the reasons. Read the command, how to handle non-adherence. Understand the barriers without judgment. The best approach to non-adherence is to explore the reasons without judgment: cost, side effects, misunderstanding, forgetfulness, or beliefs about the illness. Understanding the specific barrier lets you address it collaboratively. Blaming or scaring the patient damages the relationship and rarely improves adherence. The correct answer is E. Scolding him for being irresponsible is judgmental and damages trust, making honest disclosure of the real barrier less likely. Choice or wrong. Warning about complications to scare him uses fear rather than understanding and seldom produces lasting change. Choice C, wrong. The best approach is to explore the reasons without judgment. What is the best response? A patient with a clear viral upper respiratory infection insists on being prescribed antibiotics, saying they always make him feel better. Read the command, how to handle a demand for unneeded antibiotics. Educate and offer supportive care. Antibiotics do not work against viruses, and prescribing them needlessly drives resistance and side effects. The best response is to explain this clearly and empathetically and offer symptomatic relief for the viral illness. Good communication educates the patient rather than either caving to the demand or dismissing it curtly. The correct answer is C. Prescribing antibiotics just to satisfy the patient promotes resistance and exposes him to needless side effects, violating good stewardship. Choice A, wrong. Refusing abruptly and ending the visit is poor communication that leaves the patient feeling dismissed and unheard. Choice B, wrong. Explain why antibiotics won't help and offer symptom relief. What is the most appropriate response? A patient with chronic low back pain and several red flags for misuse insistently demands escalating doses of opioids and threatens to find another doctor if refused. Read the command, how to handle inappropriate opioid demands with misuse flags. Hold the boundary, offer alternatives. With red flags for misuse, the physician should SET, clear alignments, and offer non-opioid ID and multimodal pain management rather than escalate opioids. Caving to demands enables harm, but abruptly abandoning the patient is also inappropriate. Firm, compassionate boundaries plus alternative treatment protect the patient without simply refusing to care for him. The correct answer is D. Prescribing the opioids to avoid confrontation enables misuse and abandons the physician's responsibility for safe prescribing. Choice a wrong. Immediately abandoning the patient breaches the duty of care and leaves his pain unaddressed. Choice B wrong. Set clear limits and offer non-opioid alternatives. What should the physician do? The adult children of an alert, competent woman with a new cancer diagnosis beg the physician not to tell their mother, insisting she won't be able to handle it. Meanwhile, the patient is directly asking the physician what is wrong with her. Read the command, how to handle family collusion when a competent patient wants the truth. The patient's right to know prevails. A competent patient who wants to know has the right to the truth about her diagnosis. Autonomy and honesty require it. The physician should explore the family's concerns with compassion, but must not collude in withholding the diagnosis from a patient who is directly asking. You can be gentle and supportive in OJB, you tell her, but you cannot deceive her. The correct answer is B. Withholding the diagnosis as the family requests overrides the competent patient's right to information about her own health. Choice a wrong. Lying to the patient directly violates honesty and her autonomy, destroying trust. Choice D wrong. Explore the family's concerns, but the competent patient has the right to know. What is the best management approach? A patient with somatic symptom disorder makes very frequent visits for multiple vague physical complaints, each with a thorough negative workup. Read the command, how to manage a somatic patient. Regular scheduled visits with one doctor, avoid overtesting. The best management for somatic symptom disorder is regular, brief, scheduled visits with a single primary physician. This provides reassurance and continuity, reduces the drive for endless testing and specialist referrals, and avoids reinforcing symptoms. The symptoms are real distress to the patient, so dismissing them is both wrong and counterproductive. The correct answer is A. Telling the patient it is all in his head is dismissive and inaccurate. His distress is genuine, and it damages the therapeutic relationship. Choice C wrong. Referring him to many specialists fragments care and fuels more unnecessary testing. Choice D wrong. Schedule regular, brief visits with a single primary physician. What is the appropriate response? During examinations, a patient repeatedly makes flirtatious, seductive comments and advances toward the physician. Read the command, how to respond to a seductive patient. Set a firm boundary, use a chaperone. With a seductive patient, the physician should set a clear, respectful, professional boundary, naming that the relationship is strictly professional, and use a chaperone during exams. This protects both parties, maintains the therapeutic relationship, and addresses the behavior directly without shaming or abandoning the patient. The correct answer is C. Reciprocating the interest, even discreetly, is a serious boundary violation that exploits the physician-patient relationship. Choice a wrong. Ignoring the behavior entirely leaves it unaddressed and can allow it to escalate. Choice D wrong. Set a clear professional boundary and use a chaperone. What is the best response? An anxious patient with no clinical indication demands a whole-body MRI just to be safe, worried that something could be hidden. Read the command, how to handle a demand for an unindicated test. Educate about the harm and address the anxiety. A whole-body MRI with no indication is not harmless. It generates INC-gentle findings that lead to more tests, procedures, and anxiety. The best response is to explain why it is not indicated and to ADD rest the underlying worry driving the request. Good care means treating the anxiety, not ordering a test that can do more harm than good. The correct answer is E. Ordering the scan just to reassure him exposes him to the cascade of harms from incidental findings without any medical indication. Choice a wrong. Refusing flatly and dismissing his concern ignores the anxiety fueling the request and damages rapport. Choice B, wrong. Explain why it is not indicated and address his underlying worry. What is the appropriate response? A patient with a serious new diagnosis politely asks the physician about getting a second opinion before deciding on treatment. Read the command. How to respond to a second opinion request. Support it. It's the patient's right. Seeking a second opinion is the patient's right, especially for a serious diagnosis or major treatment decision. The physician should support and facilitate it, sharing records and welcoming another perspective. A confident, patient-centered physician is not threatened by this. It reflects the patient's engagement in their own care. The correct answer is D. Taking offense and refusing to share records obstructs the patient's care and violates their right to their own medical information. Choice A, wrong. Discouraging it as a waste of time is dismissive and undermines the patient's autonomy in an important decision. Choice B, wrong. Support the patient's right to a second opinion. Which best reflects cultural competence? A physician is caring for a patient from a cultural background different from her own and wants to provide respectful, effective care. Read the command what cultural competence looks like. Ask about and respect the individual's beliefs. Cultural competence means asking about and respecting each patient's individual beliefs, values, and practices, not stereotyping them by their background. People within a culture vary, so an individualized, curious, respectful approach is what actually improves communication and care. The correct answer is B. Assuming all patients from a culture are the same is stereotyping, which cultural competence specifically avoids. Choice A, wrong. Imposing the physician's own values disregards the patient's beliefs and undermines trust and autonomy. Choice D, wrong. Cultural competence is asking about and respecting the patient's individual beliefs. How should this be handled? A woman from a conservative religious background requests a female physician for a sensitive gynecologic examination. A female physician is available. Read the command how to handle a same-gender provider request. Accommodate it when you can. Reasonable requests rooted in a patient's religious or cultural values, such as a same-gender provider for a sensitive exam, should be accommodated when feasible. Honoring the preference respects the patient's values, protects her comfort and dignity, and supports her engagement in care. Here, a female physician is available, so accommodation is straightforward. The correct answer is A. Refusing it as discriminatory misframes a reasonable, values-based accommodation as prejudice. When honoring it actually respects the patient. Choice B, wrong. Proceeding with a male physician anyway ignores her clearly stated comfort and values when an alternative is readily available. Choice C, wrong. Accommodate the request when feasible. What should the physician do? A patient who speaks very limited English needs a detailed discussion of her diagnosis and treatment. Her 10-year-old son offers to translate for her. Read the command, how to bridge a language barrier. Use a trained professional interpreter. A significant language barrier requires a professional medical interpreter who ensures accurate, complete, and confidential communication. Using a child or family member risks translation errors, breaches confidentiality, and places an unfair emotional burden on them. A young child should never carry a parent's serious medical news. The correct answer is C. Using the 10-year-old son risks inaccurate translation, breaches confidentiality, and unfairly burdens a child with adult medical information. Choice A, wrong. Proceeding in English regardless leaves the patient unable to understand her own diagnosis and cannot support informed decisions. Choice E, wrong. Use a professional medical interpreter. What is the best response? During medication review, a patient mentions he has been taking an herbal supplement along with his prescribed drugs. Read the command, how to respond to a patient's use of supplements. Ask openly and screen for interactions. When a patient uses complementary or alternative therapies, the best response is to ask about them openly and non-judgmentally, and to check for potential drug-herb interactions or toxicity. A respectful, curious stance keeps the patient honest about what he is taking, which is exactly the information needed to keep him safe. The correct answer is E. Telling him to stop all supplements immediately without discussion is dismissive and may make him hide future use. Choice are wrong. Ignoring it as irrelevant risks missing a dangerous interaction with his prescribed medications. Choice C. Wrong. Ask about it non-judgmentally and check for interactions. How should the physician proceed? In a competent patient's culture, the eldest son traditionally receives medical information first and helps make decisions, and the patient appears to expect this arrangement. Read the command, how to honor both autonomy and culture. Ask the patient her own preference. Autonomy is honored by asking the patient how she wants information and decisions handled. She may choose to involve her family or defer to her son, a valid exercise of autonomy, but that must be her decision, confirmed directly, not an assumption. This respects both her cultural values and her right to self-determination. The correct answer is D. Automatically deferring to the eldest son assumes the patient's wishes instead of confirming them, which could override her actual preferences. Choice are wrong. Insisting she decide entirely alone imposes a Western individualist model and ignores that she may genuinely want her family involved. Choice B. Wrong. Ask the patient how she would like information and decisions handled. Which defense mechanism is this? A man harbors unconscious hostile, resentful feelings toward a colleague, but finds these feelings unacceptable in himself. Instead, he treats the colleague with exaggerated warmth, kindness, and praise. Read the command, name the defense. He converts an unacceptable feeling into its exaggerated opposite. Reaction formation transforms an unacceptable impulse into its exaggerated opposite. Unconscious hostility toward the colleague is expressed as over-the-top warmth and praise. The tell is the exaggerated, opposite behavior masking the true underlying feeling. The correct answer is A. Projection would have him attribute his OW and hostility to the colleague, insisting the colleague hates him, rather than acting overly kind. Choice B. Wrong. Sublimation channels an impulse into a socially productive outlet, not into an exaggerated opposite emotion toward the same person. Choice E. Wrong. Turning hostility into exaggerated kindness is reaction formation. Which defense mechanism is this, and how is it classified? A person with strong, aggressive impulses channels that energy into training seriously as a competitive boxer, a socially accepted outlet. Read the command, name the defense and its maturity. Channeling an impulse into something constructive is sublimation. Sublimation channels an unacceptable impulse into a socially acceptable, even productive, outlet. Here, aggression redirected into competitive sport. It is considered a mature defense mechanism because it constructively transforms the impulse rather than denying or distorting reality. The correct answer is B. Displacement redirects an emotion onto a safer substitute, target, like snapping at family after a hard day, not into a constructive activity, choice, or wrong. Reaction formation would express the aggression as its exaggerated opposite, such as excessive gentleness, rather than channeling it into sport, choice, E. Wrong. Constructive channeling of the impulse is sublimation, a mature defense. Which defense mechanism is this? A patient who has just been given a diagnosis of metastatic cancer insists there is absolutely nothing wrong with him and behaves as though the conversation never happened, refusing to believe it. Read the command, name the defense. He refuses to accept an obvious reality. Denial is the refusal to accept an external reality that is too threatening or painful. Here, a life-changing cancer diagnosis. The patient behaves as though the news does not exist. It is a common early reaction to devastating information. The correct answer is E. Projection is attributing one's own unacceptable feelings to another person, not refusing to accept the fact about oneself. Choice, a wrong. Regression is reverting to more childlike behaviors under stress, not disbelieving reality. Choice, D, wrong. Refusing to accept the diagnosis is denial. In which sleep stage does sleepwalking occur? A 7-year-old is found walking around the house while still asleep during the first third of the night. He has no memory of it the next morning. This happens during the deepest stage of sleep. Read the command. The sleep stage for sleepwalking. It occurs in the deepest slow wave stage early in the night. Sleepwalking and night terrors are parasomnias of N3, the deepest slow wave sleep dominated by delta waves, which predominates in the first third of the night. Because these events arise from deep non-REM sleep, the child has no memory of them. This is distinct from REM, where vivid dreams occur. The correct answer is C. REM sleep involves vivid dreaming and skeletal muscle. Atonia, which would actually prevent walking, so sleepwalking does not occur there. Choice A, wrong. N2 is a lighter stage marked by sleep spindles and K complexes, not the deep slow wave sleep that produces sleepwalking. Choice D, wrong. Sleepwalking occurs in N3 slow wave sleep. What is the diagnosis? A young adult has excessive daytime sleepiness with sudden sleep attacks, brief episodes of muscle weakness triggered by strong emotion, and occasional sleep paralysis on waking. The underlying cause is loss of orexin hypocretin neurons. Read the command. The diagnosis from sleep attacks, cataplexy, and orexin loss. That is narcolepsy. Narcolepsy is caused by loss of orexin hypocretin neurons and features excessive daytime sleepiness with sudden sleep attacks. Cataplexy, sudden loss of muscle tone triggered by emotion, sleep paralysis, and hypnagogic hallucinations. The combination of cataplexy and low orexin is essentially diagnostic. The correct answer is A. Obstructive sleep apnea causes daytime sleepiness through repeated airway collapse and snoring, but it does not cause cataplexy or involve orexin loss. Choice B, wrong. Night terrors are a non-REM parasomnia of childhood, not a disorder of daytime sleep attacks and cataplexy. Choice E, wrong. This is narcolepsy. What is the infant's approximate age? At a well-child visit, a healthy infant can sit without support, transfer a toy from one hand to the other, and babble, and is beginning to show anxiety around strangers. Read the command. The age from this milestone cluster. Sits unsupported, transfers objects, babbles about 6 months. At about 6 months, an infant can sit without support, transfer objects hand to hand, and babble, with stranger and anxiety just beginning. This cluster of gross motor, fine motor, language, and social milestones lines up specifically with the 6-month visit. The correct answer is D. By 12 months, an infant typically takes first steps, says the first word, and uses a pincer grasp. Abilities beyond this infant's current cluster. Choice E, wrong. At around 9 months, you would expect a pincer grasp, crawling, and object permanence, which are not yet described here. Choice C, wrong. This milestone cluster corresponds to about 6 months. What is this staging scale called? A pediatrician assesses an adolescent's pubertal development by rating pubic hair growth along with breast or genital development on a 5-stage scale. Read the command. The name of the puberty staging scale. Rating pubic hair and breast genital development is Tanner staging. Tenor, staging the sexual maturity rating, describes pubertal development in 5 stages based on pubic hair plus brace development in girls or genital development in boys. It tracks the normal progression of puberty and is the standard tool for assessing pubertal timing. The correct answer is B. The Denver Developmental Screening Test assesses gross motor, fine motor, language, and social milestones in young children, not pubertal maturity choice. D. Wrong. The APGAR score rates a newborn's condition immediately after birth, unrelated to puberty choice. A. Wrong. This puberty scale is Tanner staging. What screening tool is this? A physician screens a patient for problem drinking with 4 questions. Have you felt you should cut down? Are you annoyed when criticized about drinking? Do you feel guilty about it? Do you ever need an eye-opener in the morning? Read the command, name the 4-question alcohol screen. Cut down, annoyed, guilty, eye-opener, spells cage. The CAGE questionnaire is a brief alcohol screening tool whose 4 items form the acronym Cut Down, Annoyed, Guilty, and Eye-Opener. 2 or more yes answers suggest problematic drinking and warrant further assessment. It is quick, memorable, and widely used in primary care. The correct answer is E. The PHQ-9 screens for depression using questions about mood and anhedonia, not alcohol use. Choice A wrong. The GAD-7 screens for generalized anxiety, again unrelated to drinking. Choice B wrong. This 4-item alcohol screen is the CAGE questionnaire. What is this phenomenon called? A physician notices that she feels unusually protective and warm toward an older male patient who strongly reminds her of her late father, and she catches herself making different clinical choices because of these feelings. Read the command. Name the phenomenon where the physician's own past shapes her feelings toward the patient. That is countertransference. Countertransference is when the physician unconsciously redirects feelings from her own past relationships onto the patient. Here, warmth meant for her late father. It can bias clinical judgment, so recognizing it is key. It is the mirror image of transference in which the patient projects feelings onto the physician. The correct answer is C. Transference is the reverse, the PATN, redirecting feelings from their past onto the physician, such as reacting to the doctor as they would to a parent. Choice or wrong. Projection is attributing one's own unacceptable feelings to another person, not redirecting warmth from a past relationship. Choice B wrong. The physician's feelings toward the patient are countertransference. What is this committee? Before a clinical study involving human participants can begin, a formal committee reviews the research protocol to protect the rights, safety, and welfare of the subjects. Read the command, the committee that protects research subjects. That is the IRB. The Institutional Review Board reviews and approves research involving human subjects to protect their rights, safety, and welfare. It scrutinizes the protocol, the risk-benefit balance, and the informed consent process before a study may proceed. No human research can ethically begin without IRB approval. The correct answer is A. A tumor board coordinates the clinical treatment plan for individual cancer patients, not the oversight of research ethics. Choice E wrong. A transplant committee allocates donor organs among candidates, a different function entirely. Choice B wrong. The committee protecting research subjects is the IRB. Which set correctly lists these 3 principles. The modern ethical framework for research with human subjects rests on 3 core principles articulated in the Belmont Report. Read the command, the 3 Belmont principles: respect for persons, beneficence, justice. The Belmont Report established 3 foundational principles for human subjects: research, respect for persons, honoring autonomy through informed consent and protecting those with reduced autonomy; beneficence, maximizing benefit and minimizing harm; and justice, fair distribution of the burdens and benefits of research. These underlie IRB review and modern research ethics. The correct answer is D. Duty, dereliction, and damages are 3 of the 4 Ds of malpractice law, not principles of research ethics. Choice B wrong. Confidentiality, consent, and capacity are important clinical concepts, but are not the 3 Belmont principles. Choice C wrong. The Belmont principles are respect for persons, beneficence, and justice. What is this state of genuine uncertainty called? Randomizing patients to a new drug versus the standard treatment in a trial is considered ethical only because the expert medical community is genuinely uncertain about which treatment is better. Read the command. Name the genuine uncertainty that justifies randomization. That is clinical equipoise. Clinical equipoise is a state of genuine uncertainty within the expert community about which treatment arm is superior. It is what ethically justifies randomizing patients. If we already knew one treatment was clearly better, it would be wrong to assign anyone to the worse arm. Equipoise is a precondition for an ethical randomized trial. The correct answer is B. Therapeutic misconception is a patient's mistaken belief that research participation is individualized treatment aimed at their benefit, not the justification for randomizing choice. C. Wrong. Beneficence is the general duty to do good, too broad to name this specific precondition for a trial. Choice A. Wrong. Choice A. Wrong. Genuine uncertainty justifying randomization is clinical equipoise. What is the correct ethical position? Investigators propose a placebo-controlled trial for a condition that already has a proven effective standard treatment, which would be withheld from the placebo group. Read the command. The ethics of placebo when a proven treatment exists. Don't withhold effective therapy. Use an active control. When a proven effective treatment already exists, giving a placebo and thereby withholding that treatment is generally unethical because it denies participants known benefit. The new therapy should be compared against the standard active control, or placebo may be added on top of standard care. Placebo controls are acceptable mainly when no proven effective treatment exists. The correct answer is A. Saying a placebo is always required for validity is false. An active controlled trial is both valid and ethical when a standard treatment exists. Choice B. Wrong. Freely replacing effective treatment with placebo abandons participants' welfare, violating beneficence. Choice C. Wrong. When a proven treatment exists, use an active control rather than placebo. What does this status require? Researchers wish to enroll prisoners in a study. Because of their confined and dependent situation, prisoners may not be able to give truly voluntary consent. Read the command. What a vulnerable population requires. Additional safeguards to protect voluntary consent. Prisoners, like children, pregnant women, and the cognitively impaired, are a vulnerable population whose circumstances can compromise voluntary consent. Research with them requires extra protections and heightened oversight to guard against coercion, not outright exclusion. With appropriate safeguards, they can still participate. The correct answer is C. Saying they cannot be studied at all is too absolute. Vulnerable populations can participate with proper safeguards, and blanket exclusion could unfairly deny them research benefits. Choice or wrong. Obtaining consent from the warden only substitutes an authority figure for the prisoner's own voluntary consent, worsening the coercion problem. Choice E. Wrong. Their status requires extra protections as a vulnerable population. What should the physician do? A 15-year-old confides to her physician that she has active suicidal thoughts with a specific plan. She begs him not to tell her parents. Read the command. How to handle a suicidal minor who wants secrecy. Safety overrides confidentiality. Confidentiality. Even the minor has a safety exception. When there is imminent danger to the patient or others, it must yield. Active suicidal ideation with a plan is exactly such an emergency, so the physician must ACT to ensure her safety. which includes involving her parents and arranging urgent psychiatric evaluation. Protecting her life outweighs her request for secrecy. The correct answer is D. Keeping it fully confidential as she asks leaves a patient in imminent danger without protection, which the safety exception specifically forbids. Choice A wrong. Waiting to see whether she acts gambles with her life when there's an active plan. Choice B wrong. Break confidentiality to ensure her safety. What is required for the consent to be valid? A surgeon must obtain informed consent for a major operation from a patient who speaks very little English and does not understand the risks as explained. Read the command. What makes consent valid across a language barrier? She must genuinely understand. Use a professional interpreter. Informed consent is only valid if the patient truly understands the procedure, risks, and alternatives. Across the language barrier, that requires a professional interpreter to convey the information accurately. A signature on a form she cannot read is not informed consent, and a child interpreter cannot reliably or appropriately relay complex surgical risks. The correct answer is E. Having her sign the English form anyway produces a signature without comprehension, which is not valid. Informed consent. Choice A wrong. Using her young daughter risks inaccurate translation of complex risks and unfairly burdens the child. Choice C wrong. Provide a professional interpreter so she truly understands. What should the physician do? A competent terminally ill patient's family insists the physician not reveal her poor prognosis. The patient then looks the physician in the eye and asks directly, "Am I dying? Please tell me the truth." Read the command. What to do when a competent patient directly asks for the truth the family wants hidden. Honor her right to know. A competent patient who directly asks has the right to honest information about her own condition. The principles of truth, telling, and autonomy require it, and they override the family's request to withhold. The physician can be compassionate and gentle in how the truth is shared, but must not lie to or deflect the patient who is asking to know she is dying. The correct answer is B. Denying that she is dying is a direct lie that violates honesty and her autonomy, destroying trust. Choice A wrong. Deferring entirely to the family's wishes silences a competent patient asking about her own life, overriding her right to know. Choice C wrong. Gently tell the patient the truth she is asking for. That's the block, and the finale of the biostatistics and ethics series. 60 seconds to lock the moves. Communication points are free if you know the moves, acknowledge emotions, use plain words, and confirm understanding with teachback. Explore before you react. Hold boundaries on inappropriate demands, and a competent patient always has the right to know their own diagnosis. Ask and respect the individual, and always use a professional interpreter across a language barrier. Know your defense mechanisms and your sleep stages. Transference is the patient's, countertransference is yours. Research ethics rests on the Belmont principles, and you never withhold a proven treatment just to run a placebo arm. That completes the Biostatistics and Ethics series. 5 blocks, 200 questions, from the basics to the advanced traps. Train process, not memorization. StepLogic, learn how to think, not memorize. Next weekend, we start a new subject, microbiology.